So today I'm going to introduce Exocare, Karisma Exocare. This product has been on the market for some time. Many of you have already tried it. This is complementary therapy to Karisma RH collagen, home therapy complementing this treatment. Exosome-based skin treatment. There's a lot information about the exosomes. I haven't seen such combination of ingredients before. And the first thoughts might be, are exosomes going to work if they applied on the skin? And I will explain you how they work and why they are actually going to work. So, exosome-based skin treatment by TAUMED Karisma Exocare. Exosomes. What are exosomes? Natural and nano-stabilized bare lipid vehicles that are released from different cell types for intercellular, interspecies, and interkingdom communication. So natural exosomes are categorized into two groups, animal-derived exosomes and plant-derived exosomes, like nanoparticles. They can deliver a variety of bioactive substances such as protein, nucleic acid, lipids, and metabolites. Plant-derived exosomes are becoming very popular. We are unable to use animal-derived exosomes or human-derived exosomes in Europe. Those are forbidden. But the medical research shows huge therapeutic modalities for treating diseases using plant-derived exosomes, and their phenomenal instinct properties and minimal side effects. So, what are the advantages of exosomes? First of all, provided by nature. They have natural mechanism of cellular uptake. They are very well tolerated by the immune system, and they are non-toxic. So natural source, excellent safety, biocompatibility, and they are cost effective. If it comes to dermal penetration, once exosomes are topically applied to the skin, they will easily penetrate via the lipid-rich channel coating. Studies performed on the plant-derived exosomes demonstrate that increase in the dermal penetration efficacy are approximately 214%, which is huge increase. Revolutionary approach to anti-aging strategies, a patent technology based on plant-derived exosomes, so increase both extracellular and intracellular collagen levels, strong anti-wrinkle and elasticizing effect, and strong antioxidant action. A mix of exosomes from Italian organic agriculture, fruits, so orange, grape, pomegranate, mandarin, and papaya. So if it comes to exosomes products, there's three products. The first is exosome serum, a strong anti-aging, anti-wrinkle serum, thanks to its active ingredients, absolutely ideal home treatment to maintain the results of the Karisma injections. Exocare Bioactive Serum acts on increasing the proliferation of fibroblast, in reducing cell duplication time, in reducing oxidative stress, so helping us to age slower. We cannot prevent aging, but of course we can slow this process down. So plant-derived exosome mix from organic agriculture, hyaluronic acid, three different molecular weights, a mix of biomimetic peptides, and glycerin. After you use the serum, we are going to use the cream. So the cream is an essential component of the night home treatment. Actually, I use it both day and night. I really like this cream. So Karisma Exocare Bioactive Cream contains plant-derived exosome mix, hyaluronic acid, glycolic acid, mix of biomimetic peptides, vitamin E, and vitamin A. And the scrub shouldn't be used every day. I would recommend using scrub 2 to 3 times a week. You can take a little bit of a scrub Apply it on the face, on the treatment area, face, neck, décolleté. Massage it and leave for a couple of minutes, 2-3 minutes, and then remove with water. And the main active ingredients of the scrub are glycolic acid, manzelic acid, argan oil, sweet almond oil, and glycerin. So significant increased fibroblast proliferation, increase in extracellular collagen, increase in intracellular collagen, reduction of the cellular duplication time, reduction of the mitochondrial oxidative stress, reduction of wound healing time. And now just a quick reminder of your favorite product if it comes to professional use products. So Karisma Exocare is a home use product for your clients, for your patient. Karisma RH Collagen, it's a professional use product, product which is very popular, gaining on popularity every day, and absolutely loved by the clinics already using it. So the new approach to aging. So we're going to talk about specific anatomy and biology, product knowledge, and product use. Skin, of course, I'm not going to be talking a lot about the skin layers. We all have very good knowledge. So the epidermal and the dermal layer, epidermal maintaining the correct thickness, mitosis adjustment, differentiations of keratinocytes, and the dermal the maintenance of the colloidal state of the matrix, fibroblast proliferation, production, synthesis of its natural components. So the fibroblasts are the richest cells, full of growth factors responsible for the production of hyaluronic acid, elastin, collagen, and intracellular substances. So collagen, elastin, and the hyaluronic acid, which are also the main components of the dermis. Collagen accounts for 75% of the dry weight of the dermis, so huge amount comparing to the hyaluronic acid, which I'm going to mention in a minute. It's a rigid structure. Main components, main amino acids are, which are building blocks of the collagen are going to be proline and hydroxyproline. The most abundant collagen type in the dermis is collagen type 1, formed by 3 left-handed alpha chains, 2 alpha 1 and 1 alpha 2 chain that form triple rigid right-handed helix. So this is the procollagen chain formation. Collagen maintains the skin tone and elasticity. That's why it's so important if it comes to the aging process. After the age of 40, collagen decreases by 1% every year. Elastin gives their skin elasticity and mechanical strength. Responsible for the elastic characteristics of organ and tissue, it's rich in glycine, proline, valine, align, and lysine. Hyaluronic acid, in the Karisma RH collagen, you're going to find high molecular weight hyaluronic acid, which is produced by the thousand of disaccharide units formed by the reissues of hyaluronic acid and acetylglucosamine. It has high polarity and water solubility. The most important GAG is, of course, hyaluronic acid. High molecular weight hyaluronic acid is anti-inflammatory. If you would have low molecular weight, it would be pro-inflammatory, but high molecular weight hyaluronic acid, which is present in Karisma, is anti-inflammatory. It determines tissue hydration, it orients the collagen fibers, sort of provides the scaffold for the collagen fibers, regulates cell synthesis and differentiation, and it binds to inflammatory cytokines. It represents 0.1 to 0.3 of the dry weight of the derma only, comparing to 75% of the dry weight of the derma, which is collagen. So 75% of the dry weight of the derma, and if it comes to collagen and hyaluronic acid, only 0.1 to 0.3 of the dry weight of the derma. Collagen decreases in time. For this reason, we must induce fibroblasts to produce new type 1 collagen in our skin. And Then comes Karisma. Completely different product. Addition of R-polypeptide alpha-1 chain, high-weight hyaluronic acid, and carboxymethylcellulose. RH collagen, generated by silkworms, which synthesize type 1 collagen in alpha-1 chains and exerted in cocoons. Very low risk of allergic reaction. Silkworm threads are used for sutures. They have high solubility. They've been used for years in the surgeries. And why silkworm? Silk material is used in the medical and surgical fields, as I mentioned, and cosmetology as a silk powder. Silkworms are extremely capable in terms of protein production. Significant qualities of high quality procollagen can be produced through the expression of the procollagen in the sericin layer of the silk thread. This procollagen is made up of the same amino acid chains, the human alpha-1 collagen chain found in collagen synthesis in the human body. So complete compatibility. Polypeptide alpha-1 chain increases the production of the collagen type 1 C-peptide in fibroblast, stimulates and facilitates the winding of procollagen triple helix chains, and increase of these three propeptides, polypeptide alpha-1 R chain, which stimulate the synthesis of the collagen molecules. So biorestructuring with collagen. And first of all, what you need to remember when you are offering this treatment to your client, that the results are not going to be immediate. So the final results you'll see 2 months after the first treatment. So you're going to perform treatment 1, then 30 days later, treatment 2. If someone really needs more stimulation, you can perform 1 more treatment, so up to 3 treatments every 30 days. But this is a slow process. Collagen formation takes 92 to 98 days, complete collagen proliferation. So formation of the new collagen. And this process leads to inflammation. So induction in the production of the beta-1 transforming growth factors, which stimulate collagen production, stimulation of CD receptors CD39 and CD40, again leading to the formation of the fibroblast and formation of the fibrotic collagen. The production of type 1 collagen will produce tissue retraction with the consequent lifting effect. That's why Karisma brings such amazing results. So this is triple helix formation, which I have already explained. Hyaluronic acid, high molecular weight, so the hydration and maintenance of the environment favorable to the proliferation and metabolism of fibroblast, antioxidant action. Carbomethylcellulose are one of my favorite ingredients if it comes to use in the products. It inhibits the action of the hyaluronidase enzyme, so it's slowing down degradation of our own hyaluronic acid, preserves I can't speak today, endogenous hyaluronic acid, and slows down the action of metalloproteinase. So these are the enzymes which are degrading hyaluronic acid. That's why use of carbomethylcellulose allows for the longer presence of the hyaluronic acid in our tissue. And for that reason, we're not performing this treatment every 2 weeks, because this type of product is going to stay in our tissue for up to 28 days. So RH collagen, carbomethylcellulose, and hyaluronic acid, 2 milliliters pre-filled syringe. Injection technique: superficial dermal injection, medium deep dermal injection, and deep dermal injection. If someone has a lot of volume loss, if someone you see that connective tissue is not holding the tissue in the place, not holding the other tissues in the place as it used to be. I'm always performing injections on 2 different levels. So the deep dermal injection in a pattern, and then medium to superficial injections in between where there is need of the stimulation. So the dermal injection is papules. You can also use retrograde method, superficial and deep dermal injection, medium injection. We're injecting retrograde technique without withdrawing the needle. It's like a fan technique. So you've got a single entry point and you're fanning the product. Cannula, it's bigger extension, so the bigger spread of the product. But skin will not be stimulated. Skin will not be stimulated, and it's very difficult really to apply the product, to administer the product in the correct skin plane. So my preferred technique is still needle. So treatment areas. Now, if you pay attention, forehead lines, you need to be very, very careful when you're injecting Karisma in the forehead. It's very dense, very thick product, so the papules are going to stay. So you can do micro papules, like a really micro papules in the forehead, very superficial. The same with glabella lines, very, very superficial. Crow's feet. If it comes to crow's feet, please make sure you do not deposit Karisma under the eye. So the side, so from the eye rim to the temple. So that's what I would consider crow's feet. But do not, Karisma is not to be used under our eye. Of course, for the facelift injections, which I'm going to show you the injection points, nasolabial folds, chin, and lips. Phenomenal results for the lips. From pre-aging to anti-aging, pre-aging terms, pre-aging refers to conditions of prevention of mechanism of aging. So reduction of collagen synthesis, increase in the activity of metalloproteinase. So for someone which you're just looking for the prevention, points technique, so the traditional mesotherapy, linear retrograde technique, and superficial dermis, you don't really inject in the deep dermis. So in the deep dermis, you would inject only if someone has visible tissue loss, if someone has visible flaccidity of the skin. So treatment 0 and then treatment 1. So one treatment in 30 days and the maintenance after 4 months. Anti-aging, so if we see reabsorption of the adipose tissue and the bone in the face, so you see quite visible signs of aging. And in those more mature clients, you're going to see reduction of the thickness of the dermal matrix, reduction in the synthesis of new collagen, increased degradation of the mature collagen. So visible signs of aging, loss of elastin, loss of collagen, linear retrograde technique and medium to deep dermis. So 2 to 3 sessions every 30 days, maintenance after 3 to 4 months. And I will show you the techniques in a minute. For the clinical results, so this is the treatment of periocular and nasolabial, but remember, we do not inject directly under eye. You can inject below the rim. Otherwise, it's going to cause puffiness for a very long time. Nasolabial folds. '70-year-old patient, absolutely phenomenal results. So it was two treatments, and the treatment is going to be performed now every 4 months. Complication, bruising, swelling. Of course, if it comes to occlusion, you can cause occlusion with anything, but any product. So if you are injecting deeper, you need to have the knowledge of the anatomy and anatomy of the face and physiology of the face. Pay attention especially to the arteries. to the arteries. If you're working within the nasolabial fold, if you're working within the regions of the labial artery, if you're treating lips area, please inject superficially. Don't inject deep. Just a reminder that all the arteries are going to be more than 4 millimeters depth present. Now, to avoid excessive water recall, please do not inject Karisma directly under eyes. On the forehead, 2 to 3 millimeters max, 5 to 9 millimeters on the face, 3 to 6 millimeters on the cheek. So it's Karisma restores and directly stimulates alpha chains of collagen in the skin. Results are, as I said, are not immediate. Of course, you're going to see the plumpness of the skin due to the swelling. You are at the end of the day inserting the needle or cannula into someone's face. But the final results, so the improvement in the lines and wrinkles, improvement in the thickness and quality of the skin, is going to be visible after 2 to 3 months. So these are some of the results. One of the most difficult areas to treat, the results are phenomenal. So as you can see, we can treat all different areas. So all these results are not directly after, but after 2 months, not directly after the first treatment, but after 2 months. Neck treatment, hands treatment. Now, if you are planning to make sort of a little bit of a facelift, so mature patient with loss of elasticity, lots of trigger in the skin, so we are going to be focusing on ligaments. So I'm injecting 0.1 in all those points, and then little droplets in between where needed. So these are slightly deeper injection, 4 millimeters depth, and then superficially 1.5 to 2 millimeters tiny boluses in between. And this is another injection technique which you can use. Again, deeper injections in the ligament, on the placement of the ligaments, and then I would fill in the cheek, all this area, and around the mouth with very superficial injections. So 2 milliliters syringe. And as you can see, some deeper injections. There's no one specific pattern with Karisma, so I always focus on the ligaments if someone's skin is showing loss of elasticity, and then superficial injections where needed. 0.1 per injection. On the points showed on the pictures first, as you can see, so 5 slightly deeper points on focusing on the ligaments, and then superficial injections in between. Okay, and the hand treatment. This is hand treatment with the cannula. So entry point. You can also use mesotherapy techniques, so superficial boluses on the hands, 1 milliliter each hand. every half a centimeter injections. Um, I prefer mesotherapy injections to cannula. And two more areas. This is nasolabial folds. So as you can see, the needle is not in the subdermal region. It's in the dermis. So I would say around 2 millimeters depth, retrograde technique. You see the other side here. And the neck treatment, also superficial. You can do papules or linear retrograde technique. Very superficially. As you can see, there's no one pattern if it comes to charisma charisma treatment plans. So we are depositing product when we see loss of volume, loss of elasticity, lines, deeper lines and wrinkles. Also, on two sides of the faces, we can have completely different injection points, depending on the structure of the skin on which side of the face. So we are sleeping if we are sort of side sleepers. So you can and you should pitch and max those injection points to your clients, to your patients' needs. Brilliant. Thank you very much. I hope you enjoyed it. And please let us know about your results with Karisma.